So next we have Dr. Kumaran, again continuing the theme of OT and talking about OT sterilization and other infection control practices in OT. He has a very nice video for that, and I think so he'll wake us up from our slumber. Probably he'll crank up the sound also, all the drums and beats.
So good afternoon and a warm welcome to one and all. At the outset, where I would like to thank Dr. Gagan, Dr. Nirmal and AIOC for this wonderful opportunity. So my topic is on hospital infection control. As you would know, hospital infection control is a very vast topic, and putting them all together in 20 minutes is going to be very difficult. So I'm going to highlight only the most important or the salient features for you to take home. So I have my presentation in two formats, a slides and a video. I'm not going to play the slides for the obvious reason, as Gagan said. So I will play the video so that it could be more interesting, and I will take the questions after it gets finished. Please. So hospital infection control doesn't start only with infection control inside your operation theatre, but it also involves right from the time you enter your hospital to the disposal of all the biomedical waste. The most important is the simple hand wash. It's always good for your hospital to have a dedicated restroom and a separate room for your staff to wash your hands and feet before entering into the theatre. And once you enter in the theatre, shift to your scrubs. And if your hands are clean, it is enough to use your hand rub. But if they are soiled, you have to follow the surgical hand wash. The surgical hand wash, as you all know, the three things: above elbow, below elbow, and your wrist, with each one lasting for 30 to 40 seconds. The other important point I would like to note here is the water. The water is one of the important components of your hospital infection control, because in every process you use them. So it's always good to use a purified water, either RO or distilled water, according to the availability in your particular institute. And ensure hand wash is done properly, because it's very important. And once you do this, you enter your theatre. Make sure your theatre has all the physical parameters are properly monitored. Use your aldehyde-free, alcohol-based disinfectant to wipe all the surface of your medical equipment, including your Mayo table. Use a lint-free cloth and ensure the same part of the cloth is not used to wipe repeatedly. Once this is done, your hospital assistant then shifts all the sterile goods directly into your OT. And if you're able to keep your autoclave or the CSD area open directly into the sterile area, it makes very nice. After the hand wash, the hospital assistant then dons all the PPDs as per necessary and uses alcohol-based disinfectants as when needed. Then you prepare the Mayo table using the two-step technique, where a linen followed by a plastic. This is basically to ensure that in case you miss some products on the table, they don't reach the surface. The most important, check all your indicators starting from class 1, 5, 6, and also a biological indicator. Teach your staff how to identify failures, because most of the time they don't look into it. And a failed indicator, your surgery you finish and then you see the indicator has failed. The class 5 indicator, which I'll be talking about later, is most important. There are two vials, which I'll be talking about later. If you're following the bundle, ensure the no-touch technique is followed for the bundles, where the inner bundle remains sterile. And once this bundle is removed, ensure that this bundle also carries the Bovidic test or the class 2 to ensure that the bundles are also safe. And this is a view of the operation theatre, which is ready for surgery, and make sure there are space all around for the patients and the emergency equipments to move across. So once your theatre is over, the instrument processing, a unidirectional flow of instrument is very essential. All the used instruments, along with the biomedical waste used for this particular case, has to leave the theatre immediately. These instruments is a good practice to collect them separately and not handle them directly. These instruments are rinsed under running tap water, preferably a RO or a distilled water. This is to ensure that this removes all the dried blood and body fluids on the instrument. These instruments are then processed in an ultrasonic cleaner. InstruClean can be added, and preferably warm water is used. Once this is processed, all the instruments are then again rinsed using the 3-bin technique. They are sequentially rubbed with a fine bristle brush to ensure that all the blood and body fluids are removed. Teach your staff not to hurt themselves and the instruments, because the bluntness, because sharp instruments can get blunt. And also ensure, if you're using a chemical disinfectant or an InstruClean, ensure that you remove all the residues on the instruments to prevent TARs. And once this is done, make sure to use a high flow air gun to get the moisture out of these instruments, because if you're autoclaving these instruments, and any residual matter could hamper the sterilization process. Using a high flow air gun is very important, but ensure you also fit in a filter like this with a nano filter, which makes the air purified, and this would help you to disinfect and remove the moisture from hollow tubings as shown here. So this is very useful if you're reprocessing your instruments immediately, not allowing adequate time for them to get air dried. So here you could see how the moisture is being let out of the phaco tubings immediately using the air gun. So knowing about the autoclave, we know all about the autoclave, but you have to know a little bit more about the autoclaves, because that would help you to troubleshoot whenever you have a problem. The simple principle is water boils when the vapor pressure is equal to the atmospheric pressure. So increase the pressure inside the autoclave, so water boils more. This is a very simple technique. So autoclaves are based on 3 principles, based on the fact how they're able to remove the air inside: the vertical autoclave, gravity-based air displacement, and the other autoclave where you have a pre-vacuum and a post-vacuum cycle. And the Class B autoclave, we have multiple pulses to remove the air inside. And for ophthalmic use, when you use hollow instrument, the Class N or the Class B autoclave works well. So the autoclave, basically whatever autoclave it is, it has 2 jackets, an inner jacket and an outer jacket, with a series of valves. These valves let in the steam inside the autoclave in a graded manner for the temperature to raise and sterilize your instruments. Most of the time, these valves are the one which causes the leak, which causes a failure of the sterilization cycle. So you really need to know these valves, how they function, change the gasket or whatever is possible to ensure that they work well. So this is a simple working model of how the autoclave works. The steam is then lit, made to enter the inner jacket, wait for it to reach 121 degrees Celsius at 15 psi for 21 minutes, the sterile cycle, and then the drying cycle is altered. So you have to choose your paramedical staff of all these parameters of time, temperature, and pressure. These are the disadvantages and the advantages of a traditional vertical autoclave. So you just add on a vacuum pump to your traditional autoclave, where you have the pre-vacuum and the post-vacuum cycle. This is able to remove the air inside the autoclave, create a perfect vacuum, and hence the steam is able to penetrate all the areas and have an adequate sterilization process. When you have a multiple cycles of the steam and vacuum, is simply called the Class B autoclave. A single cycle is called the Class N autoclave. It's quicker, keeps the load dry. The most disadvantages is expensive. So now you have sterilized your instruments, and now we need to validate what we do. Validation, monitoring, and verification goes hand in hand. So you have hand dried the instruments after washing them. They should be packed as shown here. A Class 1 indicator is stuck outside. We use the plastic paper pouches for every individual case, and this instrument set having a Class 5 integrator inside each set is placed here. And use a medical grade sealant is very important, which goes around 3 inches sealant is here. And the other most important thing I would like to tell you is the way these instruments are placed inside the autoclave. Vertical placement has been proved to ensure that the steam is able to penetrate inside. The most important validating technique, the biological indicator, same vial, same number, 2 vials, one is kept outside as a control. The other is packed exactly the same way you place your instruments. And this one is placed along with your instruments and goes into the autoclave, whether it's a linen or your instruments. The Bovidic test, as I told you, is not useful for the vertical gravity-based autoclave, but you're using your Class N or your a Class B autoclave. The Bovidic test is placed inside stacks of linen. You can place as much as stacks of linen you want. They are wrapped. And the most important thing, it should be processed only inside an empty autoclave and not inside a a fully packed autoclave and place them in the most demanding part of the autoclave, which is usually the exit or the entry. Run the cycle. You need not run the warm-up, the dry cycle. Once the sterile cycle is over, the autoclave can be put off. Then you remove the stack and ensure that the Bovidic test has changed color. Once this is done, now your autoclave is ready to be packed. And ensure the Bovidic test should not be done along with your other instruments. This tells you the troubleshooting of a failed Bovidic test. The common things are air leak, unwanted condensation, faulty pack. Sometimes a warm-up cycle is needed in certain autoclaves, and an incorrect procedure. You need to educate your staff of what has to be done in the event of a failure. The class 6 works well when you're doing hollow instruments. This basically ensures your steam is removed from the hollow tubings. It consists of a 1 meter long tube with a 0.1 millimeter lumen with a case at one end. The way you fold your strip is very important. Fold it inwards and not outwards. And then it is placed inside this casing, which is then fixed to the tube. This is simply based on the principle that your autoclave should be efficient enough to remove the air first and then has the adequate pressure to push the steam inside this series of tube to reach the indicator on the other side. Again, pack it exactly the same way as you pack your phaco set and the other instruments. And then place it exactly the same way you place your instruments. So you're actually simulating exactly the same demanding technique for your instruments also. And then it is packed inside an autoclave. We have a horizontal autoclave. The advantage of a horizontal double door autoclave is that one end opens into the CSSD area, the other opens into a sterile area. So you need not take all your instruments from an unsterile to a sterile area again. The parameters, there are two parameters, 121 degrees Celsius and another one is 134, which is used for the flash sterilization process, but not to be used as a routine sterilization. This is a troubleshoot for your helix test. Based on the color change, you can see what has gone wrong. So if you're using porous loads, use the Bovidic or a hollow instrument, and both porous, use the helix PCD test, which is called the process challenge device. So your autoclaving is now over. You have to really look into all the indicators that they have changed color. And the most important one, as I told you earlier, is the biological indicator. Nowadays, you have devices which can read the biological indicator in 10 minutes. This is a perfect look of a class 5 integrator where the chemical has transversed the entire window. This is a troubleshooting of a class 5 integrator. Whenever the integrator has changed color more than 50%, the load is sterile. The biological indicator, as I told you, has two vials. One is kept outside and the other is kept inside. You remove the processed vial and you have to break the inner vial, which contains the broth and the indicator. Please place them only after breaking it, otherwise you would find all remains violet. So this makes the broth and the bacteria, which is Bacillus thermophilus, which is the most heat resistant bacillus, incubated at 57 degrees Celsius for 2 days. Most of the time, you will read the result in 12 to 16 hours itself. The maximum has to be incubated for 48 hours. This is unprocessed vial. The bacteria has grown. The vial has changed yellow in color. This is a processed vial. The bacteria is killed, so it remains violet. Sometimes you can also process these vials in a third-party NABH or NABL accredited lab to ensure that your incubator is working well. So whatever you do has to be documented, right from what is the load has to be sterilized, what are the contents of the load, what are the indicators, everything has to be recorded as shown here. So next, finally, we have done the surgery and now we have to clean your theater. Biomedical waste norms are very stringent, so ensure that all the biomedical waste are segregated at source, and they also have a unidirectional flow leading on from the sterile area directly into the disposal zone. So this is here, you see all these biomedical waste are segregated at source. They leave the they leave the operation theater immediately, including the linen if you're going to use them. Handling of sharps is very important. Never recap your sharps. They have to be destroyed as shown here. Do not burn them as used to be done earlier. The hub is also destroyed. So the main aim of showing this video is that do not recap them, because recap leads to injuries. Measure the biomedical waste and note them in a separate register. And whenever the biomedical waste is being taken out, it is very important for you to get a sign from the person who's collecting the biomedical waste, because this is very important as a legal indication also. So all the biomedical waste is disposed. Now you have to clean your operation theater. We again follow the 3-bucket technique: clear, RO water, and we mix the disinfectant in the final bucket. Use a clean and a dry mop. Sequentially immerse them as here. Make sure it is dry and not dripping. And then finally use the most time-tested figure 8 way of mopping. This basically ensures that no blind spot is left out and all the areas are well cleaned. The walls, you do not clean the roof on a regular basis, but you have to use a lint-free cloth and use the 3-bucket technique again as shown before, and clean up till probably 5 to 6 feet or however tall your assistant may be. The roofs can be cleaned once in a month or depending upon the protocol you follow in your hospital, and also depends upon your volume of your surgeries. Making the edges of your hospital theater combed as shown here could avoid a lot of problem for your cleaning staff, because dust would not accumulate. This video I've already shown you. I told you earlier, use a lint-free cloth and clean all your medical equipments, including your tables, once before you start and after you finish your theater. Biomedical waste norms of water disposal are usually neglected in most of the centers. All the biomedical waste from your hospital, the water especially, has to be collected in a separate integrated chamber, disinfected with your sodium hypochlorite solution, allowed to stand for 30 minutes before it is let into the main sewer. So after 30 minutes, there's an intermediary chamber which opens up and the disinfected water joins a normal public source. And finally, there's a short note on your HVAC system. As Dr. Nirmal told you clearly, the HVAC system is an engineering control. If you are going to install a HVAC system, you need to know the basic parts of it. There are 3 parts: the compressor, the AHU, and the terminal air filter. It's very important for you to know all these things, because otherwise during your AMC or your CMC, they would not clean these areas properly. So they have, and the return air ducts has been installed 70 to 150 millimeters above the floor level. HVAC simply means heating, ventilation, and cooling. And the main aim of this is to control the airborne particles, maintain the room pressure, moisture, and the temperature. As for now, this is the only way which you can regulate it. It converts a turbulent airflow into unidirectional airflow. The parameters inside the HVAC system or inside your theater depends upon your volume of your theater and what kind of surgeries you want to perform. Of course, a transplant theater has different norms than an ophthalmic theater. So these are the settings which we have. And this is the flow chart of the airflow. This contains 2 sets of filters, a 10-micron filter, a blower, and a 3-micron filter, which then finally leads on to a 10-micron filter, which is placed inside your theater. The physical parameters of the theater has to be monitored frequently to ensure that the negative pressure is maintained. The most important thing I want to tell here is that the head and neck of the patient has to be placed right under the hood of the HEPA filter. This particularly tells you the force which the air is sucked out of the operation theater. So all the flowing particles are taken away from the main sterile zone into the ducts. And they have to be monitored. Filter integrity test, temperature, particulate count has to be monitored regularly depending upon your volume. And finally, technological advances happen. Instead of monitoring them physically, you can also have an Android or a Google-based system where the OT parameters comes to your phone immediately 24/7. And finally, this is the last minute of my video. These are the different frequencies how you have to clean your theater. This is very important because you really have to monitor how your HVAC system is cleaned. Remember, your 10 micron filter can be water washed because these pores accumulate a lot of filters. You should not air wash your 10 micron filter. You have to water wash your 10 micron filter. The 3 micron filter should not be water washed. It has to be air washed, because if you water wash, the 3 micron filter is damaged. And then the air compressor also has to be cleaned with the water. And your HEPA filter, your terminal HEPA filter should never be cleaned. It can only be changed. And you also know what a HVAC system cannot do, because the edges are always not sterile. So a HVAC system is no alternative to proper cleaning. So HVAC is an engineering control that gives us clean, filtered air and mercury-free as for now, safe for both you and your patients. Thank you.